Okay, so today this is a great example of a young patient who is just starting to use Botox or Dysport preventatively. A lot of my patients and even friends ask me, when is it a good time to start using the neurotoxins, Dysport or Botox? And what I usually tell them is when you start to notice some faint lines appearing when you're not making facial expressions, or even if you find that your makeup or your foundation is creasing, then that is a great time to go ahead and soften those lines up a little bit. You can see on her, she really has very few resting lines. She's just starting to get a few little lines on her forehead. So today we are going to treat her frontalis muscle or forehead, which is this part right here, and then her crow's feet over here beside her eyes. Each patient that comes in is unique in their aging concerns and what bothers them and their expectations. And with her, our goal and her goal is to treat her conservatively. We still want to maintain eyebrow elevation, so we want to make sure she still has good movement, while also just smoothing out her forehead and giving her just a very pretty, smooth, natural look. So we're also going to treat her crow's feet area today over here. Can you smile for me? Let me see those lines. Yes. So I'm going to do several different injections in this area. One will actually slightly elevate the eyebrow a little bit, and then the others are going to help her eyes just appear more bright and open. And this area has been the crow's feet area has been a very popular area of treatment amongst our young patients. I think with a lot of people wearing masks these days, there's been a huge focus on eyes. And so treating this area and having your eyes appear bigger and brighter in photos and stuff like that has been a really big hit with young people.
So we're injecting Dysport in this particular situation, but there are 4 neurotoxins that are on the market in the U.S. currently. Botox is the one that everyone's familiar with because it was introduced back in the 1990s and it's been around for a long time. Dysport was the second neurotoxin that was introduced in this country over 10 years ago. And then Xeomin was followed by Xeomin about 10 years ago also. And then most recently is Jeuveau, which is again, one of the newer neurotoxins. There's really not much difference between most of these. They're all actually very similar, even though the companies may try to convince you that they're different. Dysport does have a faster onset of action. It works in about 2 to 3 days versus 5 days to 7 days for all the other ones anyway. Xeomin is so-called a pure protein. It has almost no protein coat around it compared to the others, but really that doesn't really affect its function very much. They really all last, for most patients, you'll find that they last about 3 to 4 months for most people. The higher the dose is, the longer it will last, up to maybe 4 months or 5 months or so in some patients. But average is about 3 months. So the dosing, if you use a lot more, you can get it to last longer. But of course, that costs more to use more, as well as you may get a more frozen look than you want at that time. There is one other neurotoxin that's currently in development in the United States. It's called daxibotulinum toxin. We don't know what the name is actually going to be once it is introduced. It's not FDA approved yet, but we expect it to be approved maybe in the next year or so. And it does possibly offer a difference in that it may last up to 6 months regularly in many patients. We don't know much about it yet other than that, as far as we don't know much about the dosing and so on, or what the cost will be, but perhaps it will last a little bit longer for some people anyway. All these medications are called neurotoxins or neuromodulators, and they're all related to botulinum toxin, and they're very, very safe. This is an extremely low dose compared to a dose of the toxin that would actually would make a person sick. It's extremely low compared to that. The medicines work very effectively for almost everyone. We found that they are very helpful for a lot of things besides just the cosmetic purposes. We use them also to treat patients with many other problems. Facial spasm is one of the first ones that was used for that, and all kinds of other things. They're used for migraine headaches, as you may have heard of. They're also used for sweating problems and many other things along that lines too. It's really been of course, we use them for cosmetic purposes here a lot, but they've been extremely helpful to treat a lot of different problems that we didn't really have very many good answers for until they came along.
We're all done. How was it?
Good.